Okay, Stephen, do you think we have most folk back online?
It looks like it so far, yeah.
Okay, right, so our next item then is the report on the Delegated Children's Health Services. Louise, who's speaking to this?
I believe Jane is. Are you there, Jane?
There she is. Hello, Jane. Welcome.
Thank you so much.
Okay, so we're very pleased to be receiving this report. Due to the revision of the integration agreement and COVID, we haven't considered children's services issues for some time, so it's great to have this report here. And Jane, if you would just like to introduce yourself briefly for the committee so everybody knows who you are, and then if you want to draw out any particular points in the report, please do so. Thanks.
Thanks so much, Chair. Thanks, Committee, for the opportunity. I am Jane Park. I am the Interim Head of Health here across the Highland Council and the lead for the Commissioned Health Service. I suppose before drawing out anything, just really a thank you, Chair and the Committee, for really acknowledging the hard work of all the staff across the partnership. I'll certainly be sure to pass that on to them, and it will be greatly appreciated. In terms of the report in front of you, I think what would be fair to say is that this is an update to an assurance report. I think that this really is a very brief update for the committee today, and the intention would be to provide a much more detailed assurance report to the next committee or the following one, pending your approval for that. Probably just picking out, it wouldn't be my intention to go through the report, but probably just picking out some highlights. As you see, the staff across in the Commissioned Health Service, there are almost 300 staff working in the Highland Council as part of the Commission. They've responded incredibly well across the pandemic period. We have established a health leadership structure and an interim structure with really clear lines of accountability, and that has helped create a lot of robust governance around the clinical and professional practice that we have here in the Council. We also have established professional and clinical governance framework with risk management mechanisms and escalation mechanisms through to yourself in the NHS board, and also within the Highland Council here through the health and social care risk management structures to the committees. We have had the opportunity, I would say, within the past 18 months of really increasing the scrutiny of our data. That I think it would be fair to say that we weren't very good at, so we've had a real opportunity across the past 18 months to look at our data, to understand what it means, and to really start collecting more data for purposes of service improvement and service delivery, for improving outcomes for the families out there. Another good piece of work really that's been going on for the knowledge of the committee here today is that we've been doing a lot of work around workforce profiling, planning and development, because we recognise that over the past number of years, this has probably been something that we've not been as strong at. So we've really looked at our workforce. Where are we now? Where are we likely to be in the future? How are we going to get there? How can we deliver a robust service? Now, I was listening to Simon earlier on, and of course, we have got the Feely report there. There are implications for the service across here. But that notwithstanding that, children and families out there, we are trying to achieve the best outcomes, life outcomes we can for those families. Therefore, having a workforce that is fit for purpose for children's services is incredibly important. So we've placed that high on the agenda, workforce profiling, planning and development. Probably another highlight really is on the back of that, and it's about recruitment. We had a fairly high vacancy rate up until about 18 months ago. Across the past 18 months, we've done a really aggressive recruitment programme, a safe one, dependent on the COVID circumstances, but we have established advanced nurse training programmes. So our recruitment, I should say our vacancy rates now are actually fairly low. We have one profession, and that would be a health visiting profession, that would be on our risk register, but beyond that, our vacancy rate in general sits at around between 5 and 8% across all the disciplines. but we are continually recruiting to all the vacant posts. In terms of maybe things to look out for, would be, I guess, the pressures would be around the vaccine transformation programme. And you'll see that that is mentioned in the update. We are working just now with our colleagues in the NHS Highland in terms of supporting delivery of vaccine for the expanded flu programme for secondary students. There are 13,000 secondary students who are included in that, as well as 5,000 teaching staff. So we are trying to work out how we can actually support that, given the magnitude of the programme that's out there. You will note from the update the change in role of the school nursing service, and that across the past years since we've had integration in 2012, there has been a substantial increase in the immunisation demand for school years. That has created an immense squeeze on the capacity of the school nursing service to actually deliver a service to families who are vulnerable and families who are at risk. So we are balancing competing pressures, as everybody is. We have the Transforming Nursing Roles programme, really, that's showing that if you are a school nurse working in the community, your role should be focused on mental health and wellbeing. It should be focused on vulnerable children, care experienced young people, meeting the needs of those most at risk. And the position we're currently in does require review in terms of the capacity within that particular role. So that's probably something to look out for, and that we're working with yourselves on. The other bit really to look out for would be around the workforce planning. Having done our profiling, we are about to lose within the next 18 months 20% of our health visiting workforce, and that is through retirement. We've been watching that plan through the profiling, so we can see that in the next 2 years we're at least going to lose 20%. And of course that's not just bodies on the ground, that is actually experience and knowledge of families, it's knowledge of communities. So that's something that we're really trying to be very mindful of. Just to wrap up, really not want to take up too much of the committee's time, probably next steps, you will notice that on the update there's two things that are pretty absent, and one is around performance management. This is going to be a real focus over the next 6 months. We met with Tracy and Sally just a couple of weeks ago, so we are moving forward with developing the minimum core data set, also determining some additional assurance measures as part of the Commission service, but also what we would like to do is to present the committee here and the partnership really also additional measures for improvement. So there are three aspects to performance measurements, and those would be the minimal data set, additional assurance measures, but also measures that we would like to give you that assure you for service improvement into the future. The second bit really is around finance and resource. We've done a whole load of work around that in the past 3 months, really. Roll the sleeves up. In terms of the integrated budget, you will note that from 2012, we have worked in the Highland Council using an entirely integrated budget. We've been looking at outcomes for families. We have been able to measure some health outcomes within that, of course, but we have been looking at the big picture health outcomes and life outcomes for families, and we've done that through integrated budgets, integrated teams, and integrated working systems and processes. Currently, of course, we are in the process of a disaggregation of the care and learning service, as was in the Highland Council here. So there will be an education and learning service and a health and social care service. Now that really means that for us in health and social care, we will continue to have an integrated budget. Part of my job at the minute is really to unpick the lines of those budget without disaggregating that budget. It's challenging, but I think that we really need to dig down and see where those lines are, and that's what's happening at the moment in terms of the budget. So we would like to give you a bit more detail around that within the next assurance report, so that as part of assurance, there's assurance around service delivery, there's assurance around finance and resource, and there's assurance around the workforce as well. I hope that's been helpful. More than happy to take any questions.
Okay, that's great, Jane, and you've touched on a number of points that I think people might have wanted to ask you questions on, to give us a lead there. So that's really good. Thank you. That was excellent. So I've got Michael and then James first of all. Michael.
Thank you. 20% is quite a large figure, isn't it? Is that spread evenly geographically, or is it one particular area?
At the moment, just now, the challenge would be in the south and the mid area. That's where we're projecting the challenge. At the moment, we have got a risk sitting, as you'll see within the update, within the south area. That's actually to do with maternity rather than retirement. But the projected loss within 18 months to 2 years around retirement still remains within the south and mid area.
I mentioned a while ago, I can't remember when it was, about a pathway for young people in what you might widely call health and social care as a profession, as opposed to something that you maybe do later in life, in maybe up to 10 years until you retire and that sort of thing. I'm just wondering how far we've sort of got with that. Is that, on an agenda somewhere, or is it sort of in the background somewhere?
Could you just clarify that, Michael? What do you mean by that path? Are you talking about pathway to a career in health and social care, as opposed to a service? Looking at
it as a career from school to college and that sort of thing, as opposed to something that maybe be taken up 10 years before you retire or something like that, particularly in care at home and that sort of thing. Okay,
so I'm sure that there might be a couple of people that would be able to update us on how we're addressing some of our recruitment challenges through work with young people. Do you want to go first on that, Jane? I know I can see that Simon would like to come in as well, but do you have any views on that from your perspective?
Probably from a health perspective, I would say that what we have here in the Commission services, we have qualified staff, and those would be allied health professionals and nursing staff, and we have some support staff. So we have clinical support staff. So what we are doing is we are doing a Grow Your Own as part of the advanced training programme we have here. We have modified the role of the clinical support staff so that we have clinical support staff who come in at pre-graduate level and may continue to work as part of clinical support and or go on to do registered training as either an allied health professional or as a registered nurse. The nursing roles within children's services in the community by and large are advanced practice roles. So this requires postgraduate master's levels training. So we have established a really robust postgraduate training programme within the council and fund a lot of this. So we're trying to develop the course through from undergraduate, graduate to postgraduate, so that we actually do have a workforce that's fit for purpose, if that makes sense. But that would be within children's services in the community, if that's helpful.
Just what would be the typical background of the clinical support staff when they come into the role?
The clinical support staff could be anything from a social care worker to nursing assistants who have come from, say, at Raigmore Hospital. Anybody who would have any background whatsoever can apply for a community early years practitioner post, and we would give them support and learning and development in the post here, and some members of staff have gone off to do other training.
Simon, did you want to come in on, was it this question you wanted to come in on?
Yeah, if I may, Chair, it's really just to support some of what James is saying there, and to reflect on some of the work that Louise has asked me to undertake. So even literally just before this meeting took place, I was having a discussion with one of our big care at home providers. We've got a major recruitment crisis at the moment, and the question is how do we get out of that? During COVID, we've done a few fairly amazing things. We started looking at really fast tracking how we can get people into care careers. We've been working across sectors, so not just the NHS, but with the independent sectors, at how we try to provide a kind of a mutually supportive approach towards things like training, and we've got our own in-house traineeships. But I think the big thing that we are definitely looking to be taking forward in the next few months is a larger scale level of recruiting. The only caution I add to this, which is a problem that we have in adult social care, probably more than the children's side, is the people that come to us aren't usually the ones coming direct from school. They come a bit later. The ones going direct from school tend to go into quite often childcare and into particularly nursing. The second problem is if we aren't careful about the way we
Oops, I think we seem to have lost Simon. Simon, we can't hear you at the moment. Okay, I think we'll so in the meantime, while Simon comes back to us, perhaps Louise, could you bung him a message to just alert him that he's offline? So Michael, I obviously not a great deal of that was directly related to young people, but I do know that you know, our people directorate you know, does a lot of work in terms of promoting opportunities to young people. So perhaps we could take a note, Stephen, to see if we can get some information from them for Michael out with the meeting, if that's okay.
Yeah, no problem.
Right.
Thank you, Chair.
James?
I was sorry, just to come back quickly.
No.
I was particularly interested in people that are sub-university degrees that take up a care, but they don't. It's not required them to go to university to continue their career. Thank you.
Okay, thanks. So James Brander, and then I've also got Michelle and Jerry waiting.
Okay, thank you, Anne. I've actually got 3 questions here from Philip. Philip had to go for a previously arranged appointment, so I'll just give his 3 questions. The first one, Jane, I think you've begun to answer already. Philip asks, the performance report, which is in development, is welcomed, but can you assure us that the necessary metrics the committee require will be included and provide a timescale for delivery? That's his first question. Do you want me to give me the other 2, Anne? Or
Yeah, I think just carry on, James, and then we'll come back to Jane.
The second question is Philip's interested about the progress of the Morse system and what it will deliver and the timescale for delivery. And the third question is, the report is very positive about what has been achieved during COVID. Can you outline what services or work has not been done, what the impact this will have, and how will any remedial work be addressed?
Okay, Jane, do you want to?
No bother. Yeah, thanks, James. The required matrix, yes, we are working with Tracy and Sally Amer, so the required matrix will be certainly part of performance measurements, and that really is number 1. That is, what do we absolutely have to have there, and then we're looking further down from that. So that's a quick answer to that one. Really. Second one around Morse. Now, I wish Ian Ross was here, but he's not. Ian Ross, head of e-health NHS Ireland, has done a really great piece of work around digital imperatives for child health. Now, this was a consultation that you may have seen, and it has involved consulting with stakeholders across child health services. Morse itself is an electronic record keeping system that's being rolled out. In terms of child health here in the Highland Council, it's something that in the community we would really like to move with. There's huge complexities around information storage, information sharing, in terms of community work. Therefore, to actually be part of the pilot for Morse is something that we are trying to move forward. It does need a wraparound project for that. There's no simple fix, sadly. Since I moved to Highland 15 years ago, we thought there was a very quick fix for just for all sorts of IT solutions, but of course nothing is ever simple, and no quick fix, but there does need to be a wraparound project for that. It is sitting now as part of the partnership programme board work, because it is seen as an imperative piece of work for NHS Highland and Highland Council, and as such it's sitting within the partnership programme board work and will be monitored and managed through that and progressed through that framework. Yes, the last one around what's not been done. In the last 18 months since I came into post in this interim post, the work of health visiting staff, school nurses, and really the nursing staff who work in the council here, as well as allied health professionals, for the first year across the COVID pandemic has been very strictly directed by the Chief Nursing Office of Scotland. So visits were stepped up and stepped down according to directive from the Chief Nursing Office. That really was obviously in response to the pandemic and what could and couldn't be done, and obviously was to manage risk, but as well as assure good and robust governance around what was being done. Child protection, vulnerable children, and all families with an additional HPI, as we would know them, a health plan indicator, have been an absolute focus for support across the last 18 months. So that is what has been done. You'll see from the numbers of contacts the staff have endeavoured through means that they never thought were possible. I would never have, in a million years, have said that 2 years ago that the health staff would be working in such a remote way and fairly successful way, but I think that that is something we do need to pick up with families. We need to go out and really be asking families, is this working for you? Doing Zoom calls, doing Teams calls, how well is it working for families? So what hasn't been done has been directed by the Chief Nursing Office, and that was part of the impetus around data gathering, so that we can actually start to look at what is not being done and what the impact of what is not being done. There were a number of core visits not done as part of the health visiting pathway. You'll notice that we've got 22,000 visits, developmental assessments per year. Now, at the height of the pandemic, that was pared back to a demand of around 4,000. So those visits were still progressing. So it's that kind of thing that was going, that was being pared back really as part of the pandemic. And the risks around that were being very carefully managed. So if we had a vulnerable family, we still did all the visits. We didn't pare back the visits. We actually did all the visits. We did not stop them. We continued with them. I hope that's been helpful.
Okay, thanks very much, Jane. Just before I move on to Michelle and Jerry, and then I think we might have to move on to our next item, could you maybe just clarify the point about timescales for the performance management framework? You mentioned 6 months. Is that what you're thinking about? That it might be 6 months before we see that, or might some of it come to us sooner? Thanks.
I would anticipate it will come to you sooner, Chair. I would like to think that by the next committee you will at least have the minimum data set, and that's the required matrix for the next committee. I would like to think that we'll have all three aspects of it for you. In other words, the additional assurance measures and measures for improvement, key measures for improvement, by 6 months, but you will more than certainly have the minimum code data set with you for the next committee.
Okay, thank you. So that's great. So I'll move on to Michelle first, then Jerry, and then I'll come back to Jane.
Hi, thanks very much, Anne. Hi, Jane. Thanks for that. My question is more aimed at the increase in calls that you've had regarding vulnerable families and children, and your Just Ask inquiry phone line. I'd never heard of that before we got your report. So I was having a look on, found you through the Highland website, which led me to forhighlandschildren.org page. Where all is this information being shared through social media? What platforms do you use other than the Highland Council site? Because I couldn't find anything on YouTube. And also just wondering, is there also some form of number of a form for a vulnerable young person to get in touch themselves, themselves, just to get clarification on help that they might need?
Okay, Jerry.
Thank you, Anne. It was really just a follow-up on the school nursing, and my thanks to Jane for the word she's given us on the. We continued the visits on the vulnerable children and the additional health planning needs. It was really just, probably pandemic aside, it seems to me that 75% of the available resource been taken up from school nursing on vaccine is a significant challenge. And I would just be keen, and you're probably not going to have the answer at the moment, Jane, because I think you said you're going to be exploring it through the transformation programme. Do we have an idea of, similar to the pandemic, what that is stopping has been able to do in terms of children? Because we're choosing to do A, so obviously B and C cannot happen.
Okay, Jane, do you want to respond to those 2 points?
Thank you, Chair. Yes, in terms of the Just Ask, Michelle, there is a Facebook site for Just Ask. I'm more than happy to send the links over, and YouTube. I will certainly ask Kieran, who's the Principal Officer for Allied Health Professionals, for those links, and I'm more than happy to send them across for your information. That the Just Ask helpline was set up, as you can see, 3 years ago. It is not specifically for vulnerable children. Just Ask is by and large for parents or anybody who has a health question and wants to phone up, and within a very, very quick turnaround period of time, they speak to the professional that's required, and they get an answer. We can see that from the data. There's been a lot more contact with Just Ask. There's a bigger spread now of disciplines involved in that. So when the phone call has come in and triaged out, we can see that it can go to primary mental health working service, it can be a school nursing service, it can be an allied health professional, a number of professionals. So it can really be anybody. A lot of the time it is parents and carers who are phoning Just Ask because they really don't know where else to phone. So there are community signposts for Just Ask by way of leaflets and community outreach points that notify families of Just Ask. There's lots of posters in schools and in nurseries and localities around it. But I'm more than happy to send the links across to Facebook and YouTube around that, if that's helpful. In terms of support for young people directly to come to, as part of the Highland Practice model, they do have the named person. But I think within therefore in children's services, we would be expecting in school years, children of school years, to have their guidance teacher who would be their named person, and that would be their person that would direct them through services. For preschool, of course, if it was an infant, you have your health visitor. For children, young people not in school, and I think that this is where vulnerability comes in. So for children, young people not in school, what we're looking at really is children, families who have got a social worker attached to them, and that would be a lead professional. And that lead professional really does have a really close handle on that family, and there is a core group of staff supporting the family. So that would be perhaps a school nurse and the teacher and the social worker and a support worker. So there would be a number of people, that young person who perhaps wasn't in school and couldn't readily access a named person in education, to reach out to get support. Just as a matter of interest, what we are looking into is a scheme that is running. I think it's in Leicestershire, and that is around a tech service for nursing, for school nursing. It's an anonymised tech service for young people to communicate with directly, so that they can get advice and guidance. One of the things that has been really helpful as part of the pandemic, although unintended positive consequence, should we say, is that all the staff now have got smartphones. So they are allowed, we staff are encouraged, you know, to use these smartphones with young people, so young people can contact staff face to face through the Teams on their smartphones or through the text, and that is a way that we enable young people and families to communicate now directly with staff, rather than not even sending an email, because that was a big barrier. They wouldn't do that, and they really wouldn't pick up the phone. So an unintended positive consequence of COVID has been the IT system that we've been able to generate here, and staff being all having laptops and all having smartphones to use with families out there. I hope that was helpful.
Yes, that's really
in terms of parenting support. Oh, what are the school nurses not doing now that they are doing 70% of their time vaccinating? That is a really good question, and we spoke about that not just last week but the week before. Parenting support is a big thing now, that parents now are not receiving the same level of support that they once did from the school nursing service. I think it's fair to say that education staff would not be receiving the same level of support from a school nursing service that they previously did too. So the additional support provided by the health professional through the role of a school nurse, whether that's parenting support, parenting classes, whether it's in any kind of Solihull approach, whether it's supporting education staff or supporting social work staff, that has actually had to be pared back in response to a requirement for delivery of the immunisation. I would say that this is a national issue. This is not just a local issue. The percentage of demand, of course, is completely national and comes as part of the national vaccine programme.
Okay, I note from the paper, Jane, that you know that there will be discussions about that as part of the wider vaccine transformation programme. But and obviously, as you say, this is a national issue. But I mean, do you think that perhaps other roles might be a development in this area, or you know, is there any indication of how we might respond to that rather startling statistic?
I mean, I think that there are a number of avenues that we can go down. We can do a bit of learning from the other NHS board areas who have set up immunisation teams and who have removed the function of immunisation from the school nursing role. And that has built capacity to move the mental health portion of the role into the school nurse role, and it has built capacity to do vulnerable work more closely with vulnerable families, care experienced young people, as we described. So that is one part of that. Another part is really using skill mix, and it's back to, I'm sorry, the question that was earlier on about workforce development and using skill mix. We've actually revised the role of the community early years practitioner that we mentioned earlier on. So what we're doing is we've looked at things like Solihull, we've looked at other approaches so that we've got support staff who can actually do part, as part of skill mix, can do part of the parenting support that perhaps was part of the school nursing role, to try and develop skill mix in teams.
Okay, thanks very much for that, Jane. That was a good discussion there, and just demonstrates the value of having your report here today, and we look forward to getting the performance measures once they're ready, and to hearing updates as we go along. Linda, do you want to make a comment?
It is just a quick comment, Chair. You'll be aware, of course, that the Caithness Pathfinder has launched some months ago, now known as Caithness Cares. The Sutherland Pathfinder will launch in the next week or so, and this is basically funding from Scottish Government along with a mix of services from NHS and Council, and we are there listening to young people. The different approach that we're taking is it's young people and their families, so broadly, very broadly, 15 to 26-year-olds, but we're fairly loose in the age ranges there, and their families, and it's looking and listening at what they see as needed in their community and how we grow it within the community and expand it, and hopefully that really will inform services going forward. So substantial piece